Well, good morning, everyone. My name is Brian Min. I'm a professor of political science at the University of Michigan, and I am chairing this next session of the H2D2 Research Day. We're going to give folks just a minute in case there are other folks that are working to log on right now, and then we will get started very shortly. Well, why don't we get started? Thank you, everyone, for being here and joining us. Welcome to the future. I know this isn't exactly the way we envisioned meeting today, but I am thrilled to be part of this and looking forward to some terrific presentations. Just some guidelines. We will ask each presenter to present for about 15 minutes. For those who are attending and listening in, we invite you to submit your questions. I think there is a way in which you can submit questions using the Q&A screen section of your screen. And in fact, feel free to post your questions as we go through. That way there won't be a delay in moving to the Q&A section right after each presentation. So without delay, let's get started. Our first presenter is Augustin Bergeron from Harvard University, who will be presenting on local elites as tax collectors, experimental evidence from the DRC. Augustin.
Yep. So let me know when I can share my screen. So I haven't received an invitation to share the screen yet.
Oh, I think you should be able to just do it yourself, I think.
Oh, I see. Perfect. Let me confirm. Okay. This should be this screen. This one, do you see it?
Yep, the island.
Do you see the slides? It's in full screen mode.
Slides aren't coming up.
Oh, no.
You might need to slide your screen to the other display. It seems like you're showing us the secondary display.
Sorry about that, everyone. Let me try to stop sharing and try the other screen. This one. Okay, now do you see it?
See the blue jeans screen.
You don't see the slides?
Not yet.
Should I send them by email?
Or you might not put your slides in full screen mode, because it looks like the window is showing just fine.
They're just on top of the blue jean thing.
An earlier session had the same issue with a person using a Mac. So you're not alone with this?
Yeah.
I don't quite know what to do here.
Are the slides in full screen mode right now?
No, they're not. They're just in front of my blue jean window.
That's really weird.
I think it's like a system preference thing, and I don't see how to accept. It doesn't let me accept. So maybe I should send the slides. It's going to be a bit painful and tell you to switch. Yeah. I don't know. Maybe this one. So now does it work better? No?
No. So the window in which the slides are being shown, I would suggest you try to slide it to the left or to the right.
What about this?
I think yours, no, we're not seeing it.
So should someone else present and I try to figure it offline or something?
Yeah, if you can, I just sent you a private chat with my email address. If you can send the slides
Maybe
to that
someone.
email address, I'll share and you can tell me when to move.
Yep.
Okay, should I go ahead and try the same thing?
Yeah. I think that's
Okay,
about that.
great. Now a
I
slight
have an
change.
so yeah.
Yeah, if you
we
want to
will
send
let,
your slides.
And in fact, to all the presenters, if you do want to send your slides, I don't think that would be a bad thing. But why don't we try to give Elisa a chance? Oh, I do see a set of slides now appearing. I don't know whose window that is. Is that you?
I am trying to share the slides. Let me try to put them in full mode. Can you see them?
Yes, we can. Okay, so that's great. Why don't we then move to our second presenter, and then we will get back to Augustin. This is Elisa Maffioli from the University of Michigan, and she's going to be presenting on Is the Phone Mightier Than the Virus? Cell Phone Access and Epidemic Containment Efforts in Liberia. Thank you, Elisa.
Yes, exactly. Thank you. So this is joint work with Robert Gonzalez, that is at the University of South Carolina. And I think it's pretty relevant given that infectious disease outbreak remain a major burden. We are just dealing with the coronavirus today. There's been many disease outbreak recently, just the past decade, the swine flu, the Ebola epidemic in West Africa, in the Democratic Republic of Congo, the Zika virus. And thinking about which tools are effective to try to contain the spread of a disease seems to be still first-order policy issues. So mobile phone technology has been established as being one of the powerful tools, has been used in past outbreaks. Specific mobile app has been used to share information or diagnose the disease or predict the spread of the disease. And what we are focusing in our paper is really try to take a step back, in a sense, or try to answer a much broader question. It is, how does cell phone access among the general population can help contain or potentially even spread the disease? And we are going to do that in the context of the 2014 Ebola virus disease epidemic in Liberia. We'll always refer to EVD going forward. And we are thinking about looking at the impact of mobile phone access, proxy by mobile phone coverage. And just so that you have in mind before starting with the details, our empirical strategy will be a regression discontinuity design, where we will explore the threshold at which some of the villages will have phone coverage, and for which some of the villages they will not have phone coverage. So the idea is try to find a causal effect of cell phone access proxied by cell phone coverage on the likelihood that a village has been affected by Ebola. So ex ante, we think the relationship between cell phone access and a disease, in this case Ebola epidemic, is ambiguous. And specifically on one side, cell phone access has been established as kind of a predictor of people having a larger and more accessible social network. If that's the case, and people rely on their social network, especially at early stages of the epidemic, where there are no other options, so government, international community did not have the time to intervene yet, then we might think that cell phone access can actually help or contribute to the spread of the disease. But on the other hand, I think what most of the people potentially have in mind is that there might be two other potential mechanisms for which the relationship is really the opposite. And specifically, cell phone access can help individual to have access to more information, indeed, like prevention, education, or changing hygiene practices, or also it can help actually accessing healthcare resources. So, for example, reporting sick and dead people in the case of the Ebola epidemic, requesting ambulances to get people outside of the village and to the hospital. So if that's the case, then the relationship is exactly the opposite, and cell phone access will decrease the likelihood of a village being affected by the epidemic. So just as a reminder for everyone is the Ebola epidemic in Liberia, or like in West Africa in 2014, 2016, was the largest epidemic in the history of the disease. In Liberia specifically, there were 11,000 people that were confirmed, probable, or suspected cases, and about 5,000 people that died because of the epidemic. I just wanted to show you the kind of the epidemiology of the disease and the timeline. So on the x-axis, you have the timing. The first case was recorded in Liberia at the end of March 2014. And on the y-axis, you have the number of cases weekly. So this is how the epidemic spread. There was a peak of the epidemic in September. And then basically by the beginning of the 2015 year, there were fewer than 10 cases per week, and the epidemic was completely over in 2016. There just like one main issue that will come relevant later on in the presentation is that in the first part of the epidemic, before the red line, before the peak, people really rely, or we think people really rely on their network in the sense that the government didn't do much in terms of providing services and providing information. They closed the border, they closed the school. But then all the aggressive response in terms of constructing Ebola treatment units, community care center really happen in kind of the second, what I call the second part of the epidemic, that is after September. So in our paper, we use as a data a measure of the Ebola virus disease that was constructed by a patient database that I was able to gather from the Ministry of Health, where more than 19,000 patients were recorded because tested for Ebola, for which we know whether they were positive or negative. And from these data sources, we are able to create an indicator that is for each village in the country, that is equal to 1 if there was at least one case of Ebola, either probable, confirmed, or that case recorded in that village during our study periods that goes from March 2014 to the June, July 2000. This is our outcome in our empirical model. And in terms of our regressor of interest, we're really exploring coverage, mobile phone coverage. And we were able to obtain from the Liberia Telecommunication Authority the tower location and all the characteristics of the tower, the radio frequency, and so on, in the year before the Ebola epidemic started in 2013, from the two main companies that and most of the market share at that point in time. So we are measuring signal strength on the ground through an irregular terrain model. And I don't have time to go through all the details, but just for those of you that don't know how this model works, they're basically a radio wave propagation model that predict the signal strengths of coverage. In our case, we're doing a very granular level for the entire Liberia for a kind of a cell of 100 meter by 100 meter. This has been widely used in the literature, has been repeatedly validated via on-the-ground measurement, and is one of the models that is better suited for super high-frequency radio waves that are the one for mobile phone rather than radio waves for television or radio. It used different inputs. The main one are really the transmitter characteristic and the location of the towers, the topography, and other variables like the climate zone or whether certain areas are covered by forests or not, and so on. And the output of this model is the power received at any point in time, measured in decibel milliwatts. And the idea is that when you think about using your phone, is really thinking about going from 0 bars to 1 bar, 2 bar, and so being able to make a call or send a text message. So we are exploited that threshold, that is based on the literature is at 95 decibel milliwatts in absolute value. So this is a map of Liberia. Each blue dot that you see in the map is a tower. So the part where there is nothing is really not much populated and it's forest. What the model predicts is basically the signal strength in around the tower. So the red The red area that you see is where there is enough signal strength to make a call or to send a text message, and then that's decreasing in the rest of the in the radius around the tower. So we have been pretty conservative and following the literature and using the 95 threshold. So our empirical strategy is regression discontinuity design, and we are exploiting that discontinuity in the ability to make a call at the sensitivity threshold of 95 decibel milliwatt. The outcome of interest is this Ebola indicator for a village I, having at least one Ebola case. Where then the D variable is our regressor of interest, where the village I has coverage. And then we are controlling for basically the received power net of this cutoff, 95, with the polynomial function to be flexible. We are also including flexible function of topography, elevation, and terrain slope, and we use the bandwidth that is kind of following canonical at all, like chosen optimally. So I don't have time to go through everything, but what we also show in the paper is that going closer to this threshold, the social-demographic characteristics and of the villages are getting more and more similar. The only things that different is the slope. So we will be always controlling for topography, and we have a lot of robustness check trying to isolate exactly the kind of exogenous effect of the topography that contributes to the signal strength indeed. So here is just a graph before going to the empirical results. So we do see this continuous change in the likelihood of Ebola at the coverage cutoff. So this is just renormalized, is 0, but is really the 95 threshold. And on the y-axis, you have the probability that a village has at least one Ebola case. So we look at that empirically. So our regressor of interest, again, coverage. We have a baseline specification in column 1. It has few controls. In the second column, we add additional controls. We also include different polynomials for topography with the interaction and the square of slope and elevation. We in column 4, we consider a larger bandwidth that is much larger than the optimal estimated one. We change the kernel, and we also estimate the probit model as our Ebola indicator is really a dummy, whether there is at least one case or not. And results are pretty robust and consistent. In practice, we find about 10 percentage points reduction in having an Ebola case in places that have, or in villages that have some phone coverage compared to villages that do not have mobile phone coverage. So, a result of robust alternative Ebola specification, like considering just the positive cases or the dead cases, different bandwidth. We also exploit the kind of the panel data or the monthly level data of Ebola that we have, and we also show that the contagion, if there is a contagion effect within, for example, a district or a geographical area, but that contagion effect is really diminished if the village has cell phone coverage. And I think one of the main robustness checks that is important and I want to highlight is controlling for what is called a free space model. So instead of running this terrain model, we also implemented a free space model that is a simplified version of that model that just consider basically the signal strength that depends on if there is a line of sight from the tower to the receiver. So we also control for that signal strand to try to isolate really the effect of mobile of having mobile phone coverage that really depends only on minor changes in the topography that we think are kind of exogenous. So we kind of established there is an effect and there is a decrease in the probability of having an Ebola case. But what we really care about is kind of try to look at why and what are the mechanisms. So we exploit the introduction of a toll-free nationwide phone alert system that was basically set up by the Ministry of Health as a link between the public and the government and the relief effort that the government was able to provide. this hotline number could either provide information about Ebola cases or could dispatch ambulances or send burial teams when someone would let the Ministry of Health know that there were a case of Ebola. So the call center opened around August 7, but was really effective like 1 month after, or people starting using it more and more later. So it's pretty much correspond to the peak of the epidemic. So what we have in mind is that because before the epidemic, there were no much response for the government, if there is any network effect, that should be much more relevant in the pre-hotline period. While if there is an information or care channel, then because the government really respond after setting up the hotline number, sending ambulances more frequently and providing more information, then there should be an information and care channel, or the information and care channel should be more relevant in the post-hotline period. So what we see, replotting our data, distinguishing between the pre-hotline and post-hotline period, is that the drop that we see in the probability of having an Ebola case at the village level is really driven by the post-hotline time. So what?
Elisa, I'm sorry to interrupt. You have about 2 more minutes, so just encourage you.
Okay, perfect. Yeah, thank you. So we use survey data that I collected after the Ebola epidemic to try to look at these 2 channels. So just to wrap up, we do not find, we ask people whether they the government, health worker, local or international NGO came to the village and what they did. And we replicate the exercise to explore whether there are either what are the main mechanisms. So we don't find evidence that there is that villages that has a higher coverage are more likely to receive information, but there is some evidence that actually there is higher care. So villages with coverage are more likely to having ambulances coming on time, having people coming to take sick people, and community care center around their village. So just to conclude, we find evidence that mobile phone coverage help contain the disease. And when we look at the channels of impact, we find that interventions that are designed to improve access to care might actually be more effective than intervention designed to increase the information level of people. And I think this is kind of plausible at the time of crisis, at the time of epidemic, where really the return to having an additional ambulance or having an additional doctor now at the time, for example, of the coronavirus is more likely as a higher return than having additional information. And similar to that, we also think that even if people have higher information, they need to act on it, and changing behavior of people can take much longer time than just providing an additional ambulance. So we think that the policy implications are kind of straightforward. We think, and that in normal times, there should be more investment in mobile phone technology or mobile phone towers, especially in those areas that are remote. And in the time of crisis, if actually those access to mobile phone coverage is there, governments or policymakers can exploit cell phone coverage and technology with intervention that improve access to care to contain the spread of the disease. Thank you.
Wonderful. Thank you very much, Elisa. What a timely presentation. I am sure our attendees have questions, and there's just 2 ways. There are 2 ways in which you can submit a question, either written through the Q&A function on the right side of your screen, or attendees, you can also raise your hand and just ask your questions by voice. So please consider doing that. I see there is a question in.
Yeah, I was just reading
the screen.
Okay. That. Yeah, so it seems, maybe I will read it for everyone. It seems that the difference in this discontinuity can be attributed to a single observation or a single beam, on the that is right before the threshold. Yes, so we were very worried about that too. So that's a very important question. So we try to, there is different weight that we give to some of the based on the population. So we try to remove part of those that we think might contribute to that being so high on the left of the threshold, and the results are robust. But definitely that's an important point. So thank you for asking.
Okay, so please consider submitting questions as we keep going. We are going to move to our second presentation, and if there is time at the end, we can go back to some of the submitted written questions. But let me invite back Augustin, who has now shared his slides, and I believe.
So we'll just stop there. Oh, perfect. Okay. Yeah.
Okay. Thank you very much, Elisa.
Thank you.
Augustin, yes, there we go. Okay, so here's Augustin Bergeron from Harvard.
Yeah, so now sharing screen works, I believe, or is that true?
Yes, looks good.
Do you see my slides? Okay, great. So I'm Augustin Bergeron. I'm a fifth-year PhD student in economics at Harvard, and this paper is joint work with Pablo Balan in the Gov department, Gabe Turek at MIT, and John Weigel at LSE, and it's called Local Elites as Tax Collectors, Experimental Evidence from the DRC. So in terms of motivation, fiscal capacity is important for economic and political development. Well, what's less well understood is how can developing countries escape a low tax, low capacity trap and become tax states? And in particular, one fundamental decision that's facing governments when building state capacity is the choice between centralized tax collection versus empowering local elites to collect taxes. And so this decision is seen throughout history as a function of state capacity, where we see that typically low capacity states have implemented decentralized tax collection by local elites. You can think here of the pre-Augustin Roman Empire, the Ottoman Empire, or early modern France, while high capacity states typically have implemented centralized tax collection by state agents. And so here you can think of the Roman Empire under Augustus or England after 1688. And the reason why this decision to empower local elites to collect taxes is a function of state capacity is because one potential advantage of local elite as tax collector when the state is weak is that they have lower transaction costs because they're very local, so the costs are reduced. But there are other potential advantages of empowering them to collect taxes. They might have better information, which might be a precondition to increasing compliance. And additionally, they might be better at activating citizen tax morale if they're more trusted or if they have a closer link to the provision of public services. On the other hand, empowering local elites to collect taxes potentially has disadvantages. The main one that's raised in the political science literature, it's a monitoring problem. Empowering local collectors might lead to leakage, corruption, or even outright exploitation. Additionally, it could undermine the perceived legitimacy of the government, and it could be the case that they're less good tax collector if, for example, they have less credible threat of sanction than the formal state. So the two research questions we ask in this paper are, could fragile states increase tax revenue by empowering local elites to collect taxes? And if so, what's the mechanism? And the second one is, what are the consequences of this local model of tax collection on tax incidence, but also corruption and perception of the government legitimacy? To answer those questions, we evaluate the randomization of the model of tax collection that was done by the provincial government of Kasai Central in the Democratic Republic of Congo. The context is the 2018 property tax campaign in the city of Kananga. Our unit of randomization is the neighborhood, which we have more than 300 of, and we're going to evaluate several treatment groups. The first one is collection by state agents, which I'll refer to central treatment arm in the talk. And the second one is collection by city chief, which I'll refer to local treatment arm in the talk. And later on, when I'll talk about mechanism, we also introduced an additional treatment, which is to provide information to central collectors, and we'll call this central plus local information. In terms of the outcome, we're going to look at tax compliance and revenues, but also distributional incidents, bribes, and view of the government. So our study takes place in Kananga in the Democratic Republic of the Congo. It's the fourth most populated city in the DRC with about 1 million inhabitants. And you can think of it as an urban poor setting where the median income is about $1.5 per person per day. The provincial revenue in our context are extremely low. It's about 30 cents of a dollar per person per year. And as a consequence, the government is following suits with other developing countries and trying to raise revenue using a property tax, because it allows the revenue to stay local and it's widely perceived as efficient form of taxation with very low behavioral response, at least in the short run. Door-to-door property tax collection is new, however, in our setting. It began in 2016, and as a consequence of the novelty, the level of enforcement is low, as you'll see with the baseline compliance level. To give you some detail about the property tax, it's going to work as a fixed annual fee, which is common in low-income countries in the absence of a valuation rule. So what I mean by a fixed annual fee is 90% of the properties are periphery properties. They're built in non-durable material. You can see a picture at the bottom left, and they're taxed at a rate of about $2 per year per property. The remaining 10% of our properties are called mid-range properties. They're built in durable material, and you have a picture at the bottom right, and they're taxed at a rate of about $9 per year. And so if we put those numbers in perspective and compute a tax rate in percentage of the property value, we find a tax rate of about 0.22%, which might seem low, but is actually reasonable and on the lower end of tax rates in the US today, for example. So I'm now going to talk about the design and the results. So the 2018 property tax campaign took place in 2 stages in all neighborhoods of the city. The first stage took place in the first few days of the month, and it's the property register of the full neighborhood. During that stage, the property owners receive a unique tax ID and a tax letter. The tax collector are able to collect taxes, and if needed, they make appointment for the subsequent tax visit. The remaining period of the month is tax solicitation, which takes the form of door-to-door tax appeal. The collector uses their handheld receipt printer to issue receipts to taxpayers, and they will bring the money to the government and earn a weekly bonus that's proportional to the tax they deposit. So our experiment will vary the identity of the collectors who perform both of those steps, whether it's an agent of the central government or a city chief. So in our central treatment arm, agents of the provincial tax ministry perform tax collection. They are unsalaried contractor with the tax ministry, but they might have some form of long-term incentive in the sense that high-performing agents may receive future salaried position. In our local treatment arm, the tax collector or city chief, we think the best way to think about them is as locally embedded elites, in the sense that they administer informal labor tax and resolve local disputes, and they also act as intermediaries between citizen and government in case of problems. They're appointed for long tenure. On average, it's about 10 years in our sample, and sometimes the position is heritable. 20% of the city chief inherited the post from a family member. One thing worth mentioning is that they're comparable to the central collector in the sense that they're also unsalaried. It's typically seen that status of the chief is the only compensation for being a chief, but during our experiment, both the central and the local collector will be receiving the same amount of money for tax collection, so the compensation will be kept constant. In a nutshell, we think our city chief tax collectors are similar to customary chief in their responsibility as locally embedded elite, but they're not quite the same in the sense that they're appointed. And for external validity, I think it's worth mentioning that it's a common institution across urban Francophone Africa. So researchers we've talked to who have worked in Senegal, Benin, or Ivory Coast have encountered the same city chiefs. So because we want to compare those two types of collectors, we also want to keep a few things constant across treatment, and that's guaranteed by the the protocol that the provincial government put in place. So the provincial government implemented the same training protocol and the same technology for both types of collectors. They also implemented the same financial incentives. So the tax collector receive a bonus equal to 30% of the amount collected. So both local and central, and they also kept constant, the same way, expectation about future tax collection responsibilities for both types of collector. So what we think varies across treatment is purely the identity of the tax collector, if it's a central or a local tax collector. And we're obviously aware that this is a bundle. It might be that city chief have local information or that they have local legitimacy, but they also have different demographics. They're older, less educated, and typically less wealthy. One thing worth mentioning, though, is that those demographics should lead us to expect that those city chiefs should be worse tax collector, because we see that collectors who are older, less educated, and less wealthy typically underperform. So that should be our prior before seeing the results. In terms of the data, we have administrative data from the government. That's the property registration data and the tax data from the handheld receipt printers. And we also have household survey, a baseline and endline survey, and a midline survey, where we try to follow up with all the property owners in our sample. So to jump into the results, we're going to estimate regression of the following form, where we regress our outcome of interest on an indicator for being assigned to local tax collection, where the control group is going to be central collection. We'll add a type of house fixed effect, a randomization straight fixed effect, and our standard errors are going to be clustered at the neighborhood level, which is our unit of randomization. I won't show you because of lack of time, but randomization was successful. We achieved balance across treatment for demographic and economic characteristics of both the property owner and the neighborhood. So this is our first table of results. Overall, we see on both compliance and revenue that assignment to local tax collection increased compliance and revenue. So from a very low initial rate of compliance, 7%, as I mentioned, compliance is very low in our context, we reach a level of about 11%. And it corresponds to an increase in revenue that's of similar magnitude of about a 45% increase in revenue when assigned to local tax collection. Okay? So additionally, from this increase in overall tax collection and revenue, we're thinking about what are the distributional effect of taxation by local elite. And so ex ante, it's not obvious. You can think that local elites might be more progressive than central collectors because they have local information that might allow them to be progressive in their enforcement strategy. But it's also been typically found that informal taxation that's usually done by local elite is regressive. And so we don't know ex ante what's going to be the effect. To address this, we construct property values using machine learning for all our properties in the sample, and we also rely on baseline household income. And so what we find here on the left is the result in terms of property value, is that chief tend to target lower value properties. So they look regressive in terms of property values. But on the right, the figure shows you that the chief actually target higher income households. And so what we think is happening and might be an additional benefit of taxation by the city chief is that they're able to convert this property tax in a way into an income tax and change the tax base. And it's also, which is interesting in a context where there is no income tax and only the property tax is feasible. It also suggests some evidence that city chief have an informal advantage, and that's driving the effect I showed previously, and I'll go into that when I talk about mechanism. Additionally, assignment to local tax collection results in a small increase in bribes, which is what the literature in political economy suggested, but it's small in magnitude. Oh, and there's a missing bullet, but we find no effect we find no evidence of backfiring in the sense that the missing bullet says that trust in the government actually increases when assigned to local tax collection. So we see that trust in the government increases, and so no evidence of backfiring. In terms of the mechanism, in the remaining few minutes I have, I will go over quickly 3 types of mechanism, whether chief are better at targeting visits because they have information, whether they just do more visits, or if they're better at persuading property owners to pay conditional on visits. In terms of information, chief might have information about property owners' ability to pay and their willingness to pay, which is their tax morale. And the idea of the test that would be ideal would be transferring city chiefs' local information to the central collectors and see how those central collectors perform once they have this information. This is the treatment arm we designed in partnership with the provincial government that we call central plus local information. And so the way it works is after property registration, the central collector meet with the city chief. They discuss the ability and willingness to pay of each property owner on the tax roll. And after that meeting, the central collectors collect taxes in the neighborhood as usual. So this is how the meeting look like. Typically, the enumerator is showing to the chief the picture of a house of one individual in the tax roll. The city chief might say this individual is a lawyer, he has high ability to pay, economically speaking, and high willingness to pay. The central collectors write this down on the property tax roll and then use this information when they go in the neighborhood to collect taxes. So the idea, again, is to just extract the information the chief has and transfer it to the central collector, see if they perform better. And so before looking at the results, we want to check that the information is actually, there is any information in what the chief says. And so to do this, we look at whether ease of payment and willingness to pay declared by the chief predicts tax payment, and we find evidence that it does, even conditional on property characteristics, and in an appendix table, even controlling for actually visiting individuals. So it's not just mechanical, there seems to be information in what the chief says. When we look at the result of that treatment arm on compliance and revenue, we find evidence that it matters, and that being assigned to the information group increases compliance and revenue, but substantially, but not exactly enough to close the gap with the local tax collector, but it does raise compliance and revenue. Additionally, one additional implication that this information matter is to look at the distribution. You might think that providing information not only changes the level of compliance on average, but also who gets targeted. And here we see strong evidence that once the central collectors are provided information, they look more like the local tax collectors than if they're not provided that information, both in terms of property values that are targeted by the collectors and in terms of household income of the people targeted by the collector. And finally, one additional implication of information mattering for tax collection by the local collectors is that you might think that meeting with a more knowledgeable chief would result in a higher level of tax collection. And so what we did is we asked to every chief in our sample to give the name, job, and education level of 12 citizens in the neighborhood, and we're able to match this information to a survey data. And the test we conduct is if there is a positive relationship between the chief's information and the performance of the central plus local information collectors. And we do see evidence that there is a positive relationship. Meeting with a more informed chief results in higher compliance. What's quite neat is that we can do the same test in the central neighborhoods where the chief has information, but the central collectors don't meet with that chief. And here we find no evidence that meeting with a more informed chief in the neighborhood leads to higher tax collection, which makes sense given that the meeting didn't happen in those neighborhoods. Okay, so in the last minute I have, I'll just breeze through the other mechanism potentially because we don't find evidence for these mechanisms. So you might think that it's less costly for the chief to make tax visits because they live in the neighborhood, but surprisingly maybe we find that there is no difference in number of visits or on both the extensive margin and intensive margin between central and local tax collection in terms of tax visits, but also other visits that might happen outside tax collection. Okay. You might think also that chiefs are better at collecting taxes because they are able to activate tax morale through trust and reciprocity. We don't find much evidence of this. There's no heterogeneity by baseline trust in the chief or activity of the chief or chief legitimacy. And there's no treatment effect on those outcomes of local tax. You might also think that chiefs have different sanctioning power than central collectors. So the central collectors have threats of fine or police or court intervention, but the local collectors might be able to manipulate demands for informal taxes or withhold services. Again, we don't find much evidence of this. There is no heterogeneity by perceived likelihood of sanction and no treatment effect on the perceived likelihood of sanction. And finally, we don't find evidence that tax collectors, local or central, use different threats when they collect taxes. So we don't think that's driving the result. So to conclude, we've evaluated the randomization of tax collection by central versus local collectors that was conducted by the provincial government in Kananga in the DRC. We find that local collection increased tax revenue by about 45%, and that chief target lower value property but higher income households, so they shift the tax base. In terms of non-tax outcome, we find that local collection increased bribes, but the effects are small. And importantly, we find no erosion of attitudes towards the government. If anything, trust in the government increases. So no backfiring of local tax collection. In terms of the mechanism, we document that chiefs seem to be better at targeting because they have access to local information, and that we can provide that information to central collectors to increase revenue. And we don't find evidence for other mechanisms, such as doing more visits or being better at persuading owners to pay conditional on visits. So that's it for me. This is the appendix, but I don't think I'll have time. I'm happy to answer a question, and thanks everyone. Sorry for the technical difficulties at the beginning.
Thank you, Augustin. That was fascinating. I would love for one of our attendees to participate by asking a question by voice. So if there is someone with a question, I think you can click on the hand icon and jump into the conversation.
Is there any though?
Well, in the meantime, I will ask our next presenters to start getting ready. I'm going to actually just invite all of you once again to continue to submit your questions on the Q&A section, because that way then all of our presenters can get those questions. And in fact, if you have feedback or thoughts, I am sure they would appreciate that as well. Okay, we have one question coming in. Yes, Gideon. Gideon, are you there?
You might need to unmute your audio.
Gideon, if you can hear us, I think we've invited you to join in, but we're not hearing you.
It might just take a second for him to have the ability.
Gideon, go ahead.
Oh, can you hear me?
Yes.
Yep.
All right. Yeah, Augustin, so I was just wondering, could you say just a bit more about kind of like the origins of these CD chiefs? Because I know you said they are appointed and stuff, but I'm just thinking to what extent should I think of them as, local elites, like those in, embedded in rural villages versus kind of like more urban bureaucrats in a sense?
Yeah, that's a great question. I think it's kind of an in-between. So originally, those city chief didn't really exist. They're like the analogous to a village chief, but in an urban setting. They were probably, to what we can see, at least in Kananga, they're kind of a byproduct of the colonial setting when Kananga was set and they needed to find decentralized authority. So they're technically appointed by the provincial government. So they're part of the very local level of the bureaucracy. But we think that in their responsibilities, they look pretty much like what you'd think as a customary chief, in the sense that if you're new in the neighborhood, you will go to the chief first. If the chief are going to be there to solve disputes, they implement informal tax, which is weekly labor contribution, and also have some role in interaction between the citizen and the state. So if you have a problem with your neighbor and you want to go to court, then the chief will actually channel you to the right level of administration. And for things like information campaign or vaccination campaign, the city chief are involved. And so it's kind of an interesting in-between, I think.
Okay.
So
thank you very much, Augustin. So we need to move on. Yusuf, Neggers, we will probably run a few minutes late, everyone, but thank you for your patience. Okay, go ahead, Yusuf.
Great. Can you guys see my screen properly?
Yes, it is small, but we do see it.
Perfect. All right, I'll maximize it now. Okay, great. So this is some joint work with Eric Dodge at ID Insight and Ravini Pandey and Charity Troy-Moore at Yale University. So the title of our paper is Having at Hand, How Small Search Frictions Impact Bureaucratic Efficiency. In terms of broad motivation for thinking about this project, so I mean, one thing that we definitely have seen in recent years is that social protection programs are becoming increasingly prevalent, and larger in size in countries that have managed to shift from lower income to sort of lower middle income status, but still have a large share of their population living in poverty. We're going to be focusing in this project on one such country, India, and there's been a lot of work thinking about what sort of trade-offs exist in conducting these sorts of programs along dimensions like how tightly do you want to be targeting, how large are the benefits you want to be providing, and then as a result of the combination of those two, how expensive is it actually going to be to fund and administer these programs. The tack we're going to take is to focus on somewhat of a different dimension, which is going to be the delay and unpredictability of the delivery of those benefits of whatever size they are. And you see problems of this type in a variety of different settings. And we within India are going to be thinking about the NREGA workfare program in India that I'm going to drill down and talk a little more about in about a slide or two. Now, one thing we were also interested in was, when you have these programs, it's essentially an inherent feature of them that you're going to have a multi-tiered bureaucratic hierarchy involved in administering them. And then as a result, if you think about those different tiers as maybe overlapping principal agent sort of relationships, suggest then that information constraints might actually be a big problem in this sort of setting. So it could be something along the lines of some sort of incentive alignment problem, where you need to up the monitoring of a given level of the hierarchy by the level of the hierarchy above them, or maybe that incentives are actually aligned and you're just in this setting where people think about in Rega in India and other settings like this as well, where you have your bureaucrats just being expected to do a ton of work in a really limited resource environment. So it may be something more related to capacity. Now, on a more positive note, what you also see in these sorts of settings is this nice combination where, on the one hand, these bureaucrats, even at lower levels, are going to have more technology available to them. So in our context, even in rural areas, at relatively low levels, these individuals are going to have mobile phones, smartphones actually, and also you're seeing more digital data in these contexts. So in Rega, they shifted to electronic payments. So the combination of this digital data and this increased technological availability suggests that in a way that wasn't possible even just a few years ago, you may be able to use new tools to help address these information constraints in a way that's much more cost effective than you could have before. And so, what's the setting we're thinking about more specifically? So we're going to be thinking about payment delays related to the National Rural Employment Guarantee Act or the National Rural Employment Guarantee Scheme. And so basically what that is if you're a rural household in India, you're guaranteed up to 100 days of unskilled labor per year. Now, it's really large in scale, as you might expect. It's being done at scale in India. So you've got roughly 50 million households participating in the program. The expenditure on the program is on the order of about $9 billion. Roughly 2/3 of that is going towards wages. And I think that there's the literature's been building up and suggesting in a variety of ways that for the most part, if you're a beneficiary household in the rural area with this program, NREGA tends to be beneficial for you. There are questions about other members. If you're a non-beneficiary sort of household and were wealthier to begin with, maybe it wasn't so good for you. But if you're a beneficiary household, it seems to be that it's helping you. Now, the problem is, or one such problem that exists is, while the government would like you as a beneficiary to be paid within 15 days of, say, a weekly work period, what we actually saw at the time that we were conceptualizing the project was, nationally, the average length of time it takes you to get paid was closer to 2 months, and there's a huge amount of variation in that time as well. And so you can sort of think that, well, if you've got unpredictable and delayed payment, that's really going to undermine the intended value of this program as an income smoothing and consumption smoothing mechanism. So what do we want to think about? Well, we developed a mobile phone-based app in partnership with the Indian government. And the goal of that tool was to reduce the cost for bureaucrats at various levels of the hierarchy in better identifying where delays are in this payment processing process and who the responsible subordinates are for the delays at a given payment subset. And so to evaluate the impact of this tool that we built with the government, we conducted an RCT at scale across the states of Madhya Pradesh and Jharkhand. And we want to ask questions along the lines of, how does reducing information frictions at different levels of the administrative hierarchy impact program performance, or in this case, performance, we mean payment processing times, and also whether interactions in doing so at different levels of the hierarchy concurrently, and what does that pattern of effects suggest about the types of information constraints that we have going on. Now, we're also interested in understanding, how does the effect of this treatment vary based on initial administrative performance. On the one hand, you may think, well, areas that are doing better to begin with, maybe all the low-hanging fruit, has already, been picked, and our sort of app isn't going to make much of a difference. On the other hand, in the extreme, you might think in places that are doing really badly, things are just so complicated or messed up that something as seemingly small as an app isn't going to change anything. And so so you've got this conceptual ambiguity, and therefore it's of interest to us in an empirical sense to see what actually happens. And then I should also mention that in this setting, like many other bureaucratic settings in low and lower middle countries, it's really hard to fire individuals. And so what you see is a very common policy lever to affect bureaucrats' incentives is the use of transfers. And we may be concerned about the overuse of those transfers because while they may do a good job in incentivizing behavior, if you actually end up in a world where you're transferring people around a lot, that itself may be disruptive to the performance of these sorts of programs. So we're interested in seeing, as you give bureaucrats this tool that maybe allows them to have more nuance in their understanding of what's going on, do we also see downstream impacts on transfer? So just to give a brief overview of the findings, since I'm only going to have time today to really talk about the payment time results. What we're going to find is that pay-dash provision at either the upper or middle levels of the hierarchy is going to reduce payment processing times by about 25% in areas that were performing badly to begin with, by which I mean you're a district that you're above median in terms of your pre-period payment delay problem. We're also going to find evidence of substitutability in the provision of pay-dash at either the upper and middle level of the hierarchy. And so, that result together with some other results I'm not going to have time to talk about today, it really is going to be less consistent with an environment where, the middle level bureaucrats are really not incentivized well enough to be doing their job. And it's more consistent with a setting where these are individuals who are just massively overburdened in the amount of work they're expected to do. And by reducing how hard it is for them to figure out where the problems lie beneath them in the hierarchy, we're able to see improvements in payment times. I should also mention that we do see reductions in officer transfers as well. So if you provide pay-dash to the highest level of the bureaucracy, so the district level officers, we're going to see a reduction in the movement of their subordinates at the sub-district level by about 15%. And that's going to be, even a year and a half out, we're seeing this persistent reduction in transfer rates. And this is off of a very high initial level, so that's a meaningful impact. And so like I said before, the pattern of the effects that we're going to see really suggests that it's, the mid-level bureaucrats and their constraint in being able to gather the information they need is a key constraint in this in this context. Now, just a really brief conceptual framework here is you can think of Rega administration as a three-tier hierarchy. So at the top, we're going to think of district officers as our principals. They're going to be a step removed from, they're not directly involved in the implementation of NREGA. They're monitoring at a higher level what's going on, and they desire that villagers are receiving payment on time. In the middle, we have our sub-district officers who are going to be responsible for verifying some of the work that's being done by field level officers, and they then are going to give the sign off for funds release from banks to beneficiaries. And they're also reporting on the performance of their field level officers to the district level officers, who then can punish at either the sub-district or field officer level. And at the bottom, we have our field level officers. You can think of these as the individuals who are out there in panchayats or villages, carrying out the majority of the payment process steps. And we may think that they may be inclined to shirk or to be involved in corruption. And it may also be that sub-district officers are shirking or potentially involved in corruption as well. And so what we're going to be thinking about is, it may be the case that either sub-district or sub-district officers are incurring search costs when they are gathering the information they need to understand how their subordinates are performing and where delays are lying in terms of subregions. And if we focus, particular interest to us is that middle level of the sub-district officers, where what we're interested in is, if they have the information they need and it's just that they're weakly incentivized to perform their duties, maybe where we're going to see the biggest bite is by providing pay-dash at the district level. Now, on the other hand, if it's that they're properly incentivized, the incentives are aligned, and it's just that they're overwhelmed in the amount of information that they need to gather given the resources that they have, we may see the most bite from providing pay-dash at the middle level to sub-district officers. Or it could be that both of those constraints are relevant in this context, and to see meaningful movement in payment times, we need to hit both of those levels, district and sub-district, at the same time. And so the structure of our experiment is going to be such to allow us to explore those different aspects. Now, where are we working? We're working here in these states shaded in blue on this map of part of India, where you've got Jharkhand and Madhya Pradesh. So in terms of scale, you can think of, in recent years, they're processing these weekly worker payrolls on a scale of about 20 million per year. And so what are we doing? So we're taking advantage of the fact that NREGA a couple of years ago switched to electronic payment delivery. So as a result, what you have floating around in their back-end management information system is all this time-stamped data where we know for every single weekly worker role how long each sub-step in the process is taking, and if it's stuck somewhere in the process, we know that that's happening as well. And so what we did is we developed an Android app for bureaucrats to use, either district or sub-district officers, That's going to make it easier for them to know, like what document is stuck for a given weekly worker role, who is the subordinate that is responsible for that. They can, directly contact them within the app using call or WhatsApp message. And they're also going to have available to them more aggregated time to payment performance summary information. Either, if I'm a district officer for my district, or I could drill down and see how different sub-districts are doing, either overall or on different payment sub-steps. So here I'm just going to briefly show, a couple of screenshots. So this is an example for sub-district officers, where on the left-hand side, you have, sort of your homepage with your block name, how many musters or, these weekly worker roles are about to be ready to be processed, how many are already delayed, what's your average time to payment performance. Then you can drill down by clicking on your cards and see, oh, here's a subordinate worker of mine. How is he doing? How many delayed musters is he associated with? You can scroll through and see the details on each of those musters, exactly what needs to happen. And then on this page, I'm just showing you some screenshots of, what I can do is look back over time in the top panel here. I can look at the block level, which is the sub-district, at how I'm doing overall over time relative to the dotted line, which is that 15-day desired delivery time by the government. Or you can drill down, to specific panchayats and also break it out by payment sub-step, which is what you see with those different colors there. So our experimental design is going to be pretty, yes.
Yusuf, you have about 2 or 3 minutes left.
Okay. All right. So our experimental design is going to be that, we're going to randomize across all the districts, except for 2 pilot districts in these 2 states. So you're going to have control districts, districts that were only receiving district pay dash, districts that were receiving sub-district pay dash, or districts that were receiving both. And we stratified our randomization by high delay and low delay areas, which is just, are you above versus below median in the year prior to our experiment. We rolled out in 2017. Here's a quick map of our treatment assignment. And by virtue of our random assignment, our empirical strategy is going to be quite straightforward. Right? We're going to have our outcome, which is the sub-district month level average days to complete the payment process. And then we're going to regress that on dummies for each treatment arm to turn on in the post-treatment period, as well as fixed effects for sub-district month. We're going to weight by the number of transactions in each sub-district month. We're also going to have a specification that will allow the impacts to vary by that pre-treatment period performance. So we're just going to interact our treatment dummies with dummies for whether you're in above or below median district in terms of performance. And so here are the results, the main results for now. On the y-axis here is the days to complete all officer steps. On the left-hand side, those are the results for in districts that were below median, so doing well to begin with. And D is going to be district pay dash, S is sub-district pay dash, D and S is where you're getting both district and sub-district pay dash. There we're seeing insignificant impacts on payment processing times. On the right-hand side, we see that in districts that were high delay areas, that, district and sub-district, or the combination of the two, pay dash treatment is significantly reducing time to payments. I should also note that what we don't see here is a complementarity. What we actually see is evidence of substitutability. So that third coefficient, district and sub-district in combination, is actually significantly smaller than the combination of the district plus sub-district coefficients, which is going to be much more consistent with a world where it's about information constraints for the sub-district level officer, and not so much that, they just need, we need to up their monitoring and they have the information they needed to be. We can break it out over time. The top left panel here is going to be pooling all the treatment arms. We can see 10 plus months out, you're still seeing that significant reduction in payment times. And so to conclude, what we have thus far is, it does look like mid-level bureaucrats, their information constraints are key in this area, in this context. This is consistent with, other more qualitative work that's gone on and looked at the sort of workflow patterns of sub-district level bureaucrats and how they deal with NREGA, that they just tend to be totally overwhelmed with the amount of work that they're being expected to do. And on a positive note, it does seem that while these payment delay problems are still significant, you can address them to some extent with the creation of a pretty simple mobile phone tool like we built. And this is something that's easily scalable and quite cheap to do. And we're actually in conversation with the state governments in Madhya Pradesh and Jharkhand to hand this off and have them take it over and do this at scale going forward. And as I mentioned before, we also do see reductions in transfers, which to the extent that those are disruptive to program performance may be a positive outcome as well. And then finally, the very last thing to mention is we are also gathering admin data on a whole host of other things to help us better understand other outcomes, like do we see household level work patterns reacting to increase speed of payments? What impacts do we see on funds misallocation? We're going to have some social audits data. And we also did baseline surveys with officers. We're doing end-line surveys there to better understand, exactly what's going on in a more detailed sense in the workplace. And we're also self-replicating in a lower capacity state of Bihar, and we're going to roll out another RCT at the village level with a payment information division to see if we get additional bite there. Thanks.
Thank you very much, Yusuf. I would love to invite our attendees and perhaps other presenters as well if you have questions. Attendees can click the raise hand icon and I can join you into the conversation. Yusuf, it's Brian. I actually did have a question too. So fascinating stuff. I'm wondering how you distinguish between the information effect that you were describing and let's call it a monitoring effect. The fact that now these mid-level bureaucrats have this app and have a sense that not only are they getting this information, but someone else has this information about implementation success and the pace of delivery, and whether it's the sense of being monitored that is leading to some of the results you're seeing.
Sure. So I think that what's helpful for us there is if we look at the district versus sub-district treatments. And so if what we saw was that when we were treating districts just at the sub-district level, we're seeing effects that are just as large as and in fact actually a bit larger than when we were treating both at the same time or just the district level. So with the sub-district level treatment, you're not seeing any change in the monitoring of sub-district level officers. Their superiors have the same information as in the control group. So all that's happening is that they're getting more information about what's going on in their subregions. And therefore, if it were solely about monitoring, we wouldn't expect the sub-district level treatment on its own to have those meaningful reductions in time to payment. And also based on some of the survey evidence that we're gathering right now and in conversations a little more ad hoc with people during piloting for the online survey, it does seem that it's conversation with both district and sub-district level officers. They've confirmed it's really more about information sharing. So with a district level treatment, even when those officers have it, it tends to be in conversations. We'll see with the online survey at scale what comes out, that they're using it more to pass the information along to their subordinates rather than using it to, say, up punishment of them. Now, you may say, well, that's still even indirectly somewhat of a monitoring effect. Maybe that indirectly is causing people to change their behavior too. But then I would point back to the sub-district only treatments. The fact that we still see gains there suggests it's not just about monitoring.
Terrific. Well, thank you very much to all of our presenters and for those that attended online. I know this was kind of a different way of doing the work, but terrific research, and I'm just grateful that we had a chance to hear the work that you're all doing. I just want to wish everyone the very best. Stay safe, stay hopeful, keep up the great work, and I hope we will all see each other in person very soon. So thank you very much.
Thank you.